Hey everyone, welcome back to Corporate Decoder. Today we're diving into GT Biopharma's latest annual report, and let me tell you, their financial situation is so dramatic it's practically a soap opera. We're going to break down exactly what's going on and what it means for investors, so buckle up, it's going to be a bumpy ride. GT Biopharma just filed their annual report, which covers their performance up to the end of last year. Now, the big picture is this: they're a clinical stage biopharmaceutical company. That means they are trying to discover new drugs but haven't yet successfully brought any to market. It also means they're burning through cash. The company is focused on something called immuno-oncology. Think of this as trying to get the patient's own immune system to fight cancer, specifically using natural killer cells, or NK cells. They're pretty excited about their trike and dual targeting trike technology, which they believe can target cancer without the nasty side effects of other treatments. So what's in their pipeline? It's mostly early stage, meaning it will be a while before they actually have anything to sell, assuming it makes it to approval. Their lead product, GTB 3650, is now in a clinical trial. The FDA gave them the go-ahead for clinical trials on GTB 3650. That's a big step. It targets a marker called CD33, which is found in certain types of leukemia. They also have GTB 5550, which is aimed at solid tumors. It targets another marker called B7H3. It's still in preclinical studies, meaning animal testing before human trials. They're working with the University of Minnesota on research and manufacturing. It will help them develop their products and hopefully get them ready for the market. They owe a lot of money for the work, $1.1 million to Cytovance Biologics and about $647,000 to the University of Minnesota for research they have already agreed to, and the work is ongoing. Their research agreement with the University of Minnesota is costing them $1.7 million over 2 years. Research is expensive. They also amended their agreement with the university, meaning they got better terms on future payments. Smart move because it will help them save a little bit of cash. The company is legally obligated to make forward-looking statements, so you have to take everything with a grain of salt and use your own judgment to decide whether or not you agree with the company's view. And now for the bad news. The annual report includes a warning about their ability to survive. This is as bad as it sounds. It means the auditors aren't sure they can stay in business. And for the raw numbers, they lost $13.2 million last year. They had a working capital deficit, meaning that they don't have enough short-term assets to cover their short-term liabilities. They need more money, but it might be hard to get, and if they don't get it, they may have to slow down or stop their research. That would be very bad. Another area of concern is about their internal controls, and it can affect their ability to report accurate financial results. They say they've implemented a functional system of internal controls, but such controls may become inadequate, which could lead to the discovery of material weaknesses and deficiencies. This could cause investors to lose confidence in our reported financial information. They could get sued for using other people's ideas, which would cost them time and money. Their business depends on licenses from other companies, mainly the University of Minnesota. If they mess up those agreements, they could lose access to their core technology. Even if their drugs work, the FDA might not approve them. Drug development is a long shot. Their treatments might have side effects that could delay or prevent approval. The stock could get kicked off the NASDAQ if they don't meet certain requirements. If they don't, their stock could be worthless. We are also required to furnish a report by management on the effectiveness of our internal control over financial reporting. The auditor is concerned that there are gaps in the company's processes to make sure the numbers are accurate, so that may be the case. There's a legal battle brewing with their former CFO, Manu Ori. They're accusing him of messing up and he's fighting back with his own claims. In other legal news, a case involving TWF Global was dismissed, but another similar lawsuit may be coming. Lawsuits cost time and money, and you can never be certain of the outcome. Looking at the actual numbers in the financial statements, we can see the company's money situation. Remember that going concern warning from earlier? Here's what that's based on. The report mentions the company is not in compliance with Nasdaq minimum requirements for continued listing. They need to submit a plan, but there is no guarantee of the company remaining on the exchange. Their new Chief Financial Officer, Alan Urban, has a long track record in financial positions at other companies. This includes public SaaS and content firms. It could mean he has the chops to get them back on track. They have different classes of stock with different rights, and the rights of the owners keep changing because it's not straightforward. It is a headache for investors and management. We also see that they do have warrant liabilities, which requires the company to evaluate and measure the fair value at each reporting period, which means this fair value can change depending on different factors that they must consider. The company claims that cybersecurity is important, but there is no mention of the board being involved in the practices. This also tells us that they understand that cybersecurity threats are always changing. So what do we make of all this? GT Biopharma is a risky bet. They're in a promising field, but have a lot of challenges. Their treatments are still in early stages, they're losing money, and they might not even stay listed on the stock exchange. If everything works out, this could be a huge win. However, everything needs to go right to become anything. They just settled a dispute with their former interim CEO, Dr. Gregory Burke, who alleged the company discriminated against him. Although that was a settlement that benefited the company, lawsuits are generally a big red flag. The company also has large obligations with its partner Cytovance for work that is ongoing. There are also legal battles going on with other companies that are also a red flag. The stock depends on analysts and investors, so if any reports make negative remarks, that can influence the price of the company's stock. Based on their current financials and the risks involved, a reasonable price range would be 5 cents minus $10, since there is an uncertainty on whether the company will be able to remain on the stock exchange and continue as a going concern. While their technology could be promising, but until they have a viable product, it's a very risky investment. I'm leaning bearish on GT Biopharma. Thanks for watching. If you found this helpful, please like, subscribe, and ring the notification bell for more deep dives into the world of corporate finance.